Hi everyone, my name's Nathan and I'm from the European Pain Federation, and today I'm joined by Dr. Rianne van Boekel, and today we're going to hopefully give you some more information about their plenary session at this year's EFIC 2023 Congress, which is being held in Budapest in September. Rianne, welcome.
Thank you very much.
Good to see you.
Happy to be here. Yeah.
Great stuff. Thank you so much for taking time to speak to us today. Do you want to start off just by introducing yourself and perhaps what your session is going to be about at the Congress this year?
I'm a researcher because I required my PhD by doing research on the quality of postoperative pain management. I used to do an Bayesian model to describe which structural issues and processes that we need to improve in order to achieve a better postoperative pain management. So that's my goal. So I did some research on pain assessment, treatment, but also on the prediction of pain and some evaluation studies, pain out, acute pain services, that kind of thing. Currently, I'm working as an assistant professor at the Department of Anesthesiology, Pain and Palliative Medicine at the Radboud University Medical Center in Nijmegen, the Netherlands. But I also work as a senior researcher in the Lectorate Emergency and Critical Healthcare of the Knowledge Center of Sustainable Healthcare, it's a big mouthful, School of Health Studies at Han University of Applied Sciences. And at the Han, I initiated the 2-year postgraduate program for nurses to become a pain nurse consultant. For me, the professional development of pain nurses is very important, and therefore I was the president of the Dutch Association of Pain Nurses for 7 years. And in that association, I supervised the establishment of the area of expertise of pain nursing, as well as the pain nursing domain in the Nurses Quality Register that we have in the Netherlands. And I also did collaborate with the European pain nurses, the colleagues, to develop the core curriculum for the European Diploma in Pain Nursing from EFIC, as you might well know. I was also the president of a working group that prepared the quality indicator, hospital-wide pain management. That's what we have in the Netherlands. It's commissioned by the Healthcare Inspectorate. And well, I had some board memberships of the Dutch Pain Society, the Pain Alliance in the Netherlands. And I'm also the president of the special interest group Acute Pain, the APSIG, of the International Association for the Study of Pain. I hope that's enough.
Amazing. I'm so thankful that we've got you for a little bit of a talk today, because you are one busy person.
Yes,
fantastic stuff. Great stuff. Thank you so much for that. So what's your session going to be about this year?
Well, the focus will be on options for nurse-led interventions for personalized post-surgical pain management. And I would like to bring the role of nurse-led pain management into the focus, and I will highlight most recent research in this area. But I will also connect, of course, with the theme of the conference, the EFIC 2023 Congress, personalized pain management. And of course, then my session will be related to personalized post-surgical pain management led by nurses. Yeah.
Fantastic. Really interesting stuff. So just got a couple of questions that we'd love to sort of explore a little bit further. You've obviously written about moving sort of beyond pain scores, something that everybody uses in clinical practice and within the research, you know, for the application and the assessment of post-surgical sort of pain. Why is it important to move away from that? And what should a comprehensive assessment look like?
Yes, well, moving beyond, it means that we do not have to discard all pain scores, because pain scores are, of course, very important, pain measurement by using pain scores. But my problem was that the assessment of post-surgical pain is mainly focused on pain scores. As I look in my own clinic, the nurses ask for pain scores and they just put it down and they think, okay, we're going to treat because it's a 6, because it's a 7. And we know that if you base your treatment only on a single pain score, then you may well overtreat or undertreat your patient, because we are not treating numbers, but we are treating patients. And how does your patient interpret the number? And there are also studies that show that professionals, pain professionals and patients, they interpret those numbers differently. So that's very dangerous. And so I think that if we are using pain scores, that's okay, but we should also use some other dimensions of pain. And you should do an entire pain assessment, of course, that would be the best. But in clinical practice, especially in acute pain management, you have to be a little bit more quicker with your assessment. So you have to be, you would like to have the important information as soon as possible. So that got us to think about what's really important. What do we actually want to know about these patients? Why do we having those adequate pain management? Why is it important? Well, it's important because patients need to be able to make appropriate movements that are required for healing, for the healing process. So you have to observe or ask your patient, what is it about your movements, your functioning? What can you do? What can't you do? Is pain hindering you? So that's something that I added, but we also want to know, of course, the patient opinion. Is your pain acceptable? Is it bearable? It's sometimes called. And that's why what we have been piloting since 2008. We started piloting, and now it's normal practice in our hospital and in many other hospitals in the Netherlands to have the bundle. So not only the pain scores, but also movement, functioning, and acceptability. I think that's very important.
Mm-hmm,
Yeah,
mm-hmm. I guess
that's why I wrote the article.
Brilliant. And I guess it's, providing that context around those figures and around those scores that we're collecting, and not just taking them for face value. It's what story does this number, or what story does this result tell us?
Sure, and pain scores are very important because you need them to follow up on pain. So only you can also follow up on functioning and acceptability, but acceptability, for example, is your pain acceptable to yes or no? But when pain is not acceptable, that can mean different things. It can be it's a little bit not acceptable, or it's far not
Yeah,
acceptable. That's why we still need our pain scores.
yeah,
Of
yeah,
course.
for sure. So there's still a role.
Yeah.
So yeah, in your view, a better pain management options for post-surgical pain again. Are they here? Are they on the horizon? Are they going to be here? And how optimistic should we be about, gaining these outcomes that we might, find are effective or better to use, or what?
Well, I think actually that's a very difficult
Mm-hmm.
question because, as you may know, the prevalence of moderate to severe pain after surgery, it has been really high for decades. And in the last years, we really tried to improve those results, the outcome of patients, by organizational things, acute pain services, better medication, other medication. So I think that. I'm trying to being a little bit modest just to know that, well, if we do this, then the results will improve immensely. That I think that's very difficult because we have tried so many things already. But I still think that when I'm looking at my own research and the research of others, there are so many risk factors that has been described in literature. And well, actually in clinical practice, we do not really put the output of those risk factors into our pain management plans. Um, we are very used to treat patients procedure specific. That is a very famous term in literature. But I think that we have to move from patient specific, because type of surgery, of course, is risk factor, but it's only one risk factor. We have to move to not procedure specific, but patient specific. So we should use the results that we have from the predictors, the risk factors that we know of our patients. For example, anxiety is a very famous one. And well, if a patient is very anxious before the operations, there's not really much treatment based on that anxiety. Maybe they get some pain education a little bit more. Some patients, by the way, get more anxious when they receive pain education. But I think there are so many more interventions that we can do Mostly they take a little bit more time than just giving some tablets or morphine or something. So that's a little bit different. But I think that's especially for nurses. There are so many other interventions that you can do besides the medication, of course, in combination with medication. But let's think about coaching your patient, relaxation techniques, distractions techniques, all other techniques that you can imagine. Being a nurse, we know all those basic things that make patients comfortable, and everything that makes your patient comfortable is directly reducing pain. So I think that there still are a lot of potential that we could do. Yeah.
Ways to explore. Perfect. Great explanation. And you know, we're all hopeful, right? So in a very brief sentence, why should people come to your session this year?
Well, to hear more about those nurse-led personalized post-surgical pain management, of course. I will tell you something about the recent evidence on this topic and let you know that there's far more that we can do in helping patients to reduce pain.
Amazing. It's going to be some great discussions, you know, and I'm sure you agree we could talk about this all day, but we've only got a brief amount of time today. So if anybody wants to pick up any of those points, obviously at the Congress, come and find Rianne and speak about those things. But again, thank you so much for taking time today. I really appreciate you taking a moment out of your day to give everyone some you know, a better explanation about what's going to be discussed. And everybody's really looking forward to it, me specifically looking forward to your talk as well. So again, thanks for joining us today. I really appreciate it. And I shall see you at the Congress this year.
Thank you very much.